Good afternoon to you. Thank you so much for joining us. It's time for lunchtime news this Sunday, the 18th of October 2020. It's the second day for free mass testing at the county of Nairobi. And yesterday we did see members coming out for the testing. We are also monitoring the second and the last day of this free exercise. And now joining us live from Rabai Road, where the exercise is ongoing, is my colleague Irene Muchuma Odim, who is just there trying to monitor how the exercise is going on. Good afternoon to you, Irene. Kindly tell us what's the turnout like this afternoon, considering it's the final day for this exercise.
Afternoon. We are at Rabai Road Primary School, Makadara Sub-County, and it's raining in this part of the city, disrupting activities from this end. Day 2 of mass testing by the Nairobi Metropolitan Services. This as Nairobi has the highest number of positive COVID-19 confirmed cases. And the Ministry of Health says that it's about time Nairobians turn up in numbers to have their status checked, and this in a bid to fight the spread of the virus. We're here early enough this morning, and we have witnessed quite a good number of people turning up for the exercise, especially the street families and also families from children homes. And I've tried to inquire why this number, especially from street families and those families from children's home, and reliable sources tell me that this is because when the first case of COVID-19 was reported in the country in mid-March this year, these children were asked to go back to their homes, and now for them to be integrated back to the society, back to the children's home, the caregivers would have to know their status so that they are able to take care of them in the required way according to the Ministry of Health regulations. But one thing that I'm curious to know about from this end, and it's something that I also witnessed yesterday, being day 1 of the Nairobi Metropolitan Services mass testing in the city, is the procedure. Yes, first we'll have our temperatures checked, our biodata collected, but then that procedure of collecting the sample is one that is raising more questions than answers. Why are we still having that discomfort, whereas our neighboring countries and also across the globe are making it more comfortable? To shed more light on this is Dr. Nelly Ndindi, the medical officer here at Makadara Sub-County. And doctor, just tell us why the discomfort. Why are we not advanced yet?
We are using that procedure that we are using currently, taking the oral swab and the nasopharyngeal swab, because still the nasopharyngeal swab is still the best way of getting the highest yield. So that's what we are using currently, and it's giving us good results.
Okay. Today we witnessed quite a number of people. Do we have the total number of people that have been able to turn up, as much as the rains right now have disrupted the activity for the day?
Yeah, the turnout has been fair today. So far we have already tested 136, and we are still having people coming in. Even though the numbers are a bit slow right now because of the weather, but still we are seeing the community and the members of this community here in Makadara coming in one by one, and we are hopeful by the time we are closing, maybe around 3 o'clock, we'll have gotten to higher numbers.
Just as we come to a close, today is day 2 of the exercise, and perhaps many people know this is the last day. What are the challenges that we've been able to go through, and what would be your advice way forward?
The biggest challenge we've had is the perception that the community has because of the ongoings. They are not really understanding why we are doing the mass testing exercise now, given that most of the instructions and the guidelines have been relaxed, and the numbers, for example, those that can access public events, have been increased. So we actually, as we have been doing social mobilization throughout the week, we were also sensitizing and educating the community that it is important for us to get the point prevalence in Nairobi currently, so that we can confidently say either we have dealt with COVID or we have not dealt with it yet.
Thank you. That is Dr. Nelly Ndindi, a medical officer here at Makadara Sub-County. Purity will be going round the city as Nairobi Metropolitan Services brings this exercise to a close. Though yesterday from Kibra DO's office, we got information that the exercise will still continue in government medical facilities, and we'll be inquiring that for our audience in our subsequent bulletin. Purity.
All right. Thank you so much, Irene Muchuma Odim, for that update. Of course, this is the second day of this free COVID-19 testing exercise led by the Nairobi Metropolitan Services officials. And of course, the fact that Nairobi County has been leading with the highest number of daily COVID-19 infections, then it was important for this to continue, and also with the relaxed COVID-19 restrictions. And also the Minister of Health keeps on saying that Kenyans seem to have put their guard in preventing themselves from contracting this disease down, and therefore it will be interesting to know, especially the fact that the county is saying the results for most of the people will be out by Monday. Of course, Kenya has been experiencing a lot of, let's say, a second wave or a surge in cases in the past 1 week, maintaining a 10% positivity rate.